right. Good morning, Dr. Shanta Zimmer. I'm Jeremy Collado. I'm one of the second-year residents here at Denver Health, Residency in Emergency Medicine. And we're here speaking today with Dr. Shanta Zimmer. And she was our recent Grand Rounds lecturer this past week, talking about microaggressions, specifically in diversity and inclusion. So welcome.
Thanks for having me, Jeremy. It's great to be here.
Yeah, so it's been really interesting having you here so far. We got to hear quite a bit about your role, at least in terms of the diversity and inclusion here at the University of Colorado, Denver, and specifically what you've been doing in terms of microaggressions. Can you talk to us a little bit more about that?
Many of us can think about microaggressions in the way of what are kind of considered like macro aggressions, like racism, calling people derogatory epithets, things like that. And those are pretty easy to identify and to say we have no tolerance for. Some of the more subtle ways that we kind of eat away at people's self-esteem or their sense of value in our communities, whether that's our community of trainees or our hospital or even our community of society, don't always come with intent. And so they're a lot harder to address. If somebody intentionally harms another person, all of us, I think, feel strongly about standing up. But when it's that gray zone, if you're not sure if that was hurtful or not, it can be a lot harder to address. And I have learned a lot from students, trainees, colleagues who come from diverse backgrounds about what their experiences are like on a day-to-day basis and how some of these subtle slights can add up over time to really significant harms. And I think, especially in medicine, when we all kind of have this commitment to making people feel better, that recognizing that those kind of little slights are happening over time and have lasting effects motivate us to change them. It's also the sort of stuff that isn't going to be fixed, overnight. Microaggressions and harms that happen unintentionally through unconscious biases don't go away with one Grand Rounds, lecture. They really change with hard conversations over time with people who are comfortable with one another, and a lot of allyship.
And then for our listeners and viewers, do you mind giving us a little bit more, maybe an example of microaggression that we might hear, whether it be somewhere in healthcare or not? And
now, one of the ones that your faculty actually, repeated during the conversation is this question of where do you come from? And asking that question to doctors who may obviously, on an external look, appear to be different than the rest of the people, maybe in the emergency department, for example. And so with saying, where do you come from, over time can feel like you're saying, you don't belong here.
Right.
The intent of that comment might actually just be, hey, I want to get to know you better. What training program did you come from before you were here? Or how long have you been living in Colorado? We know that people are uncomfortable when they're seeking their health care. Maybe they're just trying to make rapport.
Right.
The other comment side of that, though, is it could be about, hey, I want somebody who looks more like me and you don't belong here. And those subtle differences can actually kind of grate on people and take away their self-confidence, their sense of self-worth, their sense of belonging in the community that they're in.
If you can travel back in time and maybe advise your younger self of something in particular, what would you say, whether it's leadership or otherwise?
My mom would want me to say right now, hey, Mom, be a leader, not a follower. She said that to me so many times when I was growing up that we really actually had a conversation when I was in high school, and I finally turned, and I was like going to college and everything. I turned to her and I was like, is it okay for you to stop saying that to me now that I'm like,
I've gotten there already.
I'm getting in this direction? And I think she, and now I find myself telling my kids, be the head, not the tail, like on the way out the door. I'm like, oh, I'm becoming my parents.
Make those good decisions.
Make those good decisions. So I think you can also not take yourself so seriously.
Right.
I would have told myself that a lot earlier. Maybe that's something that you can't understand until you get older and realize that not everything is life or death. But I think when you're younger, you tend to kind of cut yourself off by taking yourself too seriously.
So thinking back at maybe a turning point in your life, whether it's good or bad, can you think of maybe what that might have meant to you then and how that might be a little bit different to you now?
So a more recent one actually was in 2008. My husband was recruited to the University of Pittsburgh, and I was in the middle of my K award in my research I did basic science research at the time. I was transitioning to a lot of educational things at the time. I had been at Emory forever. I trained there. You guys heard that on Wednesday. I did all my training there, medical school, everything. I had a great community, left family, all of those kinds of things. And I got a lot of growth out of it. And it really is what gave me the opportunities that I have here now. You'll say, like, how did the personal thing work out? You're hating your husband for moving you to a new institution. I know you're not brave enough to ask me that question, but it actually ended very well for us too, because our family had to find new friends, and that meant that we relied on one another a lot to make that transition happen. So it ended up being really good for both of us, although it didn't look like it at the time.
Sort of growing together as a family and moving on from there.
Yep.
And it's interesting, especially talking to so many people in academia and other, just in professional life in general, a lot of times you hear that story of, I was forced to do this is not my first choice, this is not what I necessarily wanted, and looking back, they're like, this is what made my life. So with all of these things that you've done throughout life, is there anything in particular that looking back you're most proud of? And sort of the second part to that question, looking forward, is there something that you think that you hope to be most proud of in the future?
That question made me feel like I'm 100 years old. Looking back on my life, what am I most proud of?
We all get older by the day, right?
It was that third grade win. Kind of, I think from a professional standpoint, I feel most proud right now. And proud is a really weird word, because I think once you get into leadership roles, what you become proud of is what other people are doing, and the sense of accomplishment that comes from watching other people grow and thrive. But from a personal standpoint for me, I've been really pleased with the way we've been able to make connections with our students who come from diverse backgrounds, and to kind of really dig into these difficult conversations and the response that people have. You know, you think like, oh, that's a hard topic, it's going to be like not very approachable, but I'm very proud of the fact that on our campus these dialogues are happening, and people are digging in. People are standing up in conferences and saying, this is what I feel, this is what I experience. That's awesome. And I think our country needs a lot more of that kind of authenticity. This is what I feel, this is what's important to me, this is who I am. So if I can be a little part of that dialogue, I'm very proud of being able to be a part of that dialogue. For the future, in terms of what I think I'll be most proud of in the long run, I actually have to, on the personal side, say I think I'm pretty confident about whose hand I'm going to be holding when I die or when he dies. And I'm going to be most proud of the fact that that was long-lasting and hopefully a model to our kids.
Well, I think that's really profound, and I think our viewers and listeners will really appreciate that. Yeah, I think that's important for especially us that are residents, and I have a significant other and we have a daughter at home, and thinking about those things and making sure you're there for them, and realizing that sometimes you're not going to have that time, but they're still important, and they're the people that got you there and the people that love you and care for you, and looking back on it, I think that's very important.
Yeah, and if you make good kids to grow up to be good citizens, then that, you know, will change the world, right?
Yeah, absolutely. Thank you. Really appreciate that. Well, thanks so much for being with us today. Thank you so much for all the wisdom and feedback. And I'm sure you have so much more to learn and so much more to go, as we all do. And I really appreciate that humility that you've spoken with us today. So thank you so much.
Thanks for having me, Jeremy.
Right.
It's great.
Thank you.
Thanks.